With the latest series of The Traitors fresh in our minds, I thought I'd tell you about a rather treacherous forensic case that was published in the International Journal of Legal Medicine. It involves a guy in his 40s, let's call him Mike, and he has an on-off tempestuous relationship with a woman 7 years his senior, let's call her Sarah. And they date for 13 years between 1995 and 2008. And then they break up, and a bit later he marries somebody else, let's call her Kathy, and they have kids. But they divorce in 2016, and soon after his divorce, Mike looks Sarah up and they begin to rekindle their relationship. Then about 10 months later, something mysterious happens. After an evening seafood meal, Mike takes himself to A&E, or the ER, complaining of serious abdominal pain that's spreading to his legs. But the doctors can't find out what the cause of the pain is, and they send him away with painkillers telling him to take ibuprofen daily. A week later, he's admitted to hospital again, this time complaining of hypersensitivity to pain, fluctuating mood and weeping. This time the doctors take him a bit more seriously and do CT scans and ultrasounds of his abdomen and lumbar punctures, and they still can't find a cause for his pain. They think it's psychosomatic, caused by conflict, because now Kathy has re-entered his life and is accusing him of abusing his children, and they think that it's anxiety and depression, so they give him anxiety meds and painkillers. 3 weeks later, he's back in hospital. This time his hair is falling out, he's severely constipated, and he's suffering from unexpected weight loss. After 7 weeks of medical investigations, doctors are still no closer to finding out what's causing Mike's problems. Sarah, at this point, suggests that he get tested for heavy metal poisoning, and she arranges a blood test. And sure enough, he's found to have 175 micrograms per litre of thallium in his blood. And thallium is a tasteless, odourless and water-soluble element that can be fatal if ingested or inhaled in large amounts. Now that doctors know what the problem is, they can begin to treat him. And slowly over the next 4 weeks, the thallium levels in his blood decrease to 12 micrograms per litre. Police are beginning to suspect that he might have been deliberately poisoned, and they look at the people around him. He's currently having his meals provided by his sister and brother-in-law, let's call them Janet and John, but they have absolutely zero motive to want him ill or dead. His ex-wife, Kathy, does have a motive. She's accusing him of abusing their children, but she lives in a faraway town and has no access to him at all, or his apartment, or anywhere to get him any thallium. The police ask about Sarah, his current partner, but Mike dismisses this outright. She is taking such good care of him. She is coming to visit him in hospital every day. She's bringing him clean clothes and snacks, and she's taking really good care of him. So eventually, the criminal investigation dries up. Fast forward to 2020, when Mike has left Sarah and is living symptom-free. He is living his best life, decides to sell a watch on eBay, and goes to a cafe to meet the buyer. He orders a Diet Coke and sits outside on a cafe table. But just as he's finishing his Diet Coke, he sees some white crystals in the bottom of the glass and gets suspicious, takes some samples and calls the police, and gets himself straight to A&E. And sure enough, it's found to be thallium sulfite crystals. His blood is tested for thallium and it's found to have 1,230 micrograms per litre of blood, a potentially fatal level. Luckily, he's treated, he's given charcoal, Prussian blue, which is the antidote for thallium, laxatives, and eventually, in a few days' time, he's well enough to leave the hospital. Did you spot the traitor? Whose name was on your slate? Well, unbeknownst to Mike, Sarah had been following his movements. She'd put a GPS tracker on his motorbike. She had been watching his internet activity, and she'd seen his watch for sale on eBay. She'd hired somebody to purchase the watch and to arrange the meeting at the cafe, and she'd snuck into the cafe before he arrived, and then when the waitress went past with his Diet Coke, she'd spiked it with thallium sulfite crystals. When it became obvious that it was her, the police searched her apartment and they found traces of arsenic and thallium in her apartment, in her handbag, and all over her belongings. The court came to the conclusion that Sarah had tried to poison Mike twice. The first, when they were together, was an attempt to stop him leaving her, and the second, once he had left her, was an attempt to get her revenge and kill him. Did you spot the traitor? Could you spot one in your life?